Hi everyone, I'm back with what might be the continuation of the last video that I did, and I'm sorry. It's taken me a while to get back because I have been that busy. However, my topic for discussion today is section 66 is why therapy. By that I mean we have patients who have physical therapy, speech therapy, occupational therapy. Why do they have to have therapy? Well, first of all, we have to understand that sometimes when we see a sick patient, some of them, let's be honest, do look almost like a vegetable, like there's no life left in them. Some of these patients do not present a pretty picture, but that does not mean that they're not aware of their surroundings and that there is no hope and that there's nothing that can be done for them. It starts out that way, and of course that's what the purpose of therapy is we work hard with them and, manage to give them the therapy that they need. It helps them to get back again. Many of them do, some don't. Some never really progress to anything, but there are many who look very hopeless. And indeed, they do work their way back to being very valuable human beings. So let's start, first of all, with the injured brain. Well, we do know one thing, that the brain has many functions. And I'm not going to be able to go into all of them, but I'll just give you an example. I've given you here a very good outline of the different areas of the brain and what the problems are that they present when they have, like, if something happens in the frontal lobe, there's damage to the frontal lobe, you may have difficulty with motor activity. It also does things like bladder control. And let's take the area called Broca's area in the front. It's sort of, it's a speech production area is what it is. You can look at the map and see it more clearly. Well, if that area is damaged, obviously people have difficulty with their speech. Then you have the temporal lobe, for example. They have difficulty with memory and hearing. And then we can go on to the parietal, where you have difficulty with I believe it's with things like math calculation. And then there's occipital, which has to do with vision. And then you have the Wernicke's area, which is lower down in the brain stem, and that is called like speech comprehension. They have difficulty understanding what is the spoken word that's being said. So you can just take your time and look at it carefully, and you'll be able to understand more. I've just given you here some examples of people who have injuries of different kinds and what the expectations are. All three of these people have something in common. It goes without saying that they all have different type of injuries. As you can see, the guy on the left, in the upper on the left corner, he has something to do with fell from a ladder, and he's got he's wearing one of those halo braces, and that is tough. I had a family member who had a halo brace. She did very well. She walked again, but not everybody. So it's pretty difficult because you have to turn your whole body around. You cannot turn your neck. And those screws, you have to keep them clean because the holes go all the way through the bone. Anyhow, you can see that lady on the right, she has a prosthesis. And for that reason, she's learning to walk, and she's having some difficulty too because she has to learn to balance on that walker. And sometimes it's just not that easy, especially if the brain is injured. And then the lady down on the left-hand side, she had a stroke, and you can see she's in a wheelchair, and that again presents its own challenges. So regardless of the cause, rehabilitation serves a very wonderful purpose. Now we will go on a little bit further to some other kinds of injuries, and just one moment. Post again, these people are different types of therapy again. Physical therapy, occupation and speech therapy. This patient on the treadmill is learning to walk again, so that's obviously physical therapy. And then the speech therapist is taking care of the same lady we saw in the other picture who had a stroke. And one of the things that's suggested with people who are learning to speak again, the speech therapist said, is when they learn to swallow, they learn to speak better. So swallowing is very important. And we had that with our family member. We had to feed him even water from a spoon, but he did learn to swallow again. His back on a regular diet and swallowing without any problems and speaking very clearly. So it is true. And then you have this other patient here who had amputations, and that is quite challenging because sometimes if the prosthesis don't fit, they have a lot of difficulty with walking. Yeah, just do the best you can. I'm doing the best I can to help you out. Anyway, I just wanted to let you know also I started another site called quizmenurse.blogspot.com, and it's packed with helpful information for any nurse, whether you're a nursing student or you might just be interested in finding out information about nursing. You can use it. And I also am trying, but working on it, not getting very far, but just what I've got up. It's called patreon.com/Dear Nurses. That one, I'm working on it. Haven't gotten very far, but there is helpful information there, like things like infection control and so. I hope this has been beneficial to you. Have a wonderful day.